Most older adults are aiming for the wrong blood pressure target, and it might be making things worse. The guidelines changed, but many people over 60 are still chasing numbers that were meant for younger adults. I'm Ben Harris, and today I'm walking you through what the research actually shows about safe blood pressure ranges after 60, why measurement matters more than most people realize, and the one mistake that sends more seniors to the emergency room than high readings ever do. The order of what you focus on makes all the difference. Here's what you need to know. 1. The target range shifts with age, and the old 120/80 rule no longer applies the same way after 60. For most older adults, a top number between 130 and 140 is often safer than pushing it lower. The bottom number matters too, but the top number gets most of the attention because it reflects how hard your heart works with each beat. This protects your brain and kidneys. When you're older, blood vessels are less flexible, and your body needs slightly higher pressure to push blood through effectively. Going too low can reduce blood flow to vital organs. Margaret turned 68 last spring. She checked her pressure at home one morning and saw 138/84. She panicked, thinking she was in danger, and called her daughter. Her daughter drove her to urgent care. The doctor there asked Margaret if she had any symptoms: headache, chest pain, dizziness. She didn't. He explained that 138/84 is actually within a reasonable range for someone her age, especially without symptoms. Margaret had been aiming for 120/80 because that's what she remembered from years ago. The doctor told her that target made sense when she was 50, but now it could do more harm than good. Margaret left with a new understanding. Over the next month, she stopped worrying every time her top number touched 135. Her readings stayed steady, and she felt calmer. Your arteries stiffen naturally with age. This is called arterial stiffness. It means your blood vessels don't expand and contract as easily as they used to. Because of this, your heart has to generate a bit more force to move blood through your system. A slightly higher top number reflects that reality. It doesn't mean your heart is failing or that you're in immediate danger. It means your body is adjusting to the way your vessels have changed. For most people over 60, a top number consistently above 150 is worth attention. But anything in the 130s or low 140s without symptoms is often appropriate. The bottom number should usually stay below 90. If it climbs into the mid-90s or higher, that's a separate concern worth discussing with your doctor. If you have heart failure, kidney disease, or a history of stroke, your doctor may set a different target. Those conditions change the math. But for otherwise healthy older adults, aiming for a top number in the low to mid-130s is usually a safe and realistic goal. This understanding protects you from unnecessary worry and from pushing your pressure too low with medication. If this is making sense so far, subscribe for more blood pressure and blood sugar guidance tailored to older adults. 2. Measurement technique matters more than the number itself, and most people get at least two things wrong every time they check. Even a perfectly healthy person will see a falsely high reading if the cuff is too small, the arm is hanging down, or they haven't rested. Home monitors are helpful, but only if you use them correctly. Accurate measurement gives you reliable information. If your readings are all over the place, you can't tell what's real and what's technique error. That confusion leads to unnecessary medication changes or missed problems. Robert is 72. He bought a home monitor after his doctor suggested tracking his pressure between visits. For 2 weeks, Robert checked every morning. His readings ranged from 128/78 to 158/92, sometimes within the same hour. He thought something was seriously wrong. He brought his log to his next appointment. His doctor asked him to demonstrate how he took the reading. Robert sat down, rolled up his sleeve, wrapped the cuff around his upper arm while his arm hung at his side, and pressed start. His doctor stopped him. She explained that his arm needed to be supported at heart level, that he should sit quietly for 5 minutes first, and that rolling up a tight sleeve can squeeze the arm and raise the reading. She had Robert rest, then positioned his arm on the desk, cuff over bare skin. His reading came back 135/82. She asked him to take a second reading after 1 minute. It was 133/80. Robert realized his wild swings were mostly technique errors, not dangerous fluctuations. Your arm position changes the reading because of gravity and muscle tension. If your arm hangs down, gravity pulls blood in the lower arm, and the monitor has to work harder to sense the pulse. That can add 10 points or more to the top number. If your arm is above heart level, the reading can drop artificially. The cuff also matters. Most adults need a standard cuff, but if your upper arm measures more than 13 inches around, you need a large cuff. A too small cuff squeezes the arm and gives falsely high numbers. Always check the cuff size guide that came with your monitor. Rest before checking. Sit quietly for 5 minutes. Don't talk, don't look at your phone, don't think about your to-do list. Let your body settle. Support your arm on a table or armrest so your elbow is roughly level with your heart. Sit with your back against the chair, feet flat on the floor, legs uncrossed. Wrap the cuff over bare skin, not over clothing. Position it about 1 inch above your elbow. Press start and stay still. Don't hold your breath. Breathe normally. Take 2 or 3 readings 1 minute apart. Write down all of them. The first reading is often higher because your body is still adjusting. The second and third readings are usually more accurate. Average those if they're close. If you have severe arthritis in your shoulders or if sitting still causes pain, ask your doctor or a nurse to help you find a comfortable position that still supports your arm properly. This approach gives you trustworthy data and keeps you from chasing false problems. Comment your age and usual top number range. 120s, 130s, 140s, or 150 plus. It helps me understand what's most useful to cover. 3. Time of day changes your reading by 10 to 20 points, and most people don't realize their pressure follows a daily rhythm. Your pressure is usually lowest overnight while you sleep, starts climbing an hour or two before you wake, peaks in late morning, dips in the afternoon, and rises again in early evening. This is normal. It's controlled by your body's internal clock and your nervous system. Knowing this rhythm prevents confusion. If you check at different times and see different numbers, you might think something is wrong. But if you understand the pattern, you can track trends instead of reacting to every shift. Linda is 65. She started checking her pressure at home after her doctor mentioned it was creeping up. Linda checked first thing in the morning, right after she woke up and had coffee. Her top number was often 148 or 152. She panicked. Later in the day, she'd check again, and it would be 132 or 135. She thought her monitor was broken. She brought it to her next appointment and asked her doctor to test it. Her doctor explained that the monitor was fine. Linda's morning readings were higher because of her natural rhythm and because caffeine raises pressure temporarily. Her evening readings were lower because her body was winding down. Her doctor told her to check at the same time each day, either morning or evening, but not both, and to skip caffeine for 30 minutes before checking. Linda picked evenings. Over the next 2 weeks, her readings were consistent, mostly in the low 130s. She realized she wasn't spiking dangerously in the morning. She was just seeing her body's normal rhythm. Your nervous system controls this cycle. In the morning, your body releases hormones like cortisol to wake you up. These hormones also raise your heart rate and blood pressure. Activity, meals, and stress throughout the day keep your pressure elevated. In the evening, as your body prepares for rest, those hormones drop and your pressure comes down. This is healthy. It means your system is working the way it should. Pick one time of day to check and stick with it. Morning works for some people. Evening works for others. Just be consistent. If you check in the morning, do it before breakfast and before coffee or tea. Sit quietly first. If you check in the evening, do it before dinner or at least 1 hour after eating. Avoid checking right after exercise, after an argument, or after anything stressful. Those situations temporarily raise your pressure, and the reading won't reflect your baseline. Write down the date, time, and reading. Over a week or two, you'll see your pattern. Bring that log to your doctor. One high reading means very little. A pattern of high readings at the same time of day means something. If you take blood pressure medication, your doctor may want you to check at a specific time to see how well the medication is working. Follow that guidance. This awareness helps you see what's normal for you and stops you from reacting to natural variation. If you're finding this helpful, subscribe so you don't miss future videos on blood pressure and blood sugar. 4. White coat effect is real and stronger after 60, which means your reading at the doctor's office is often 10 to 30 points higher than it is at home. The stress of being in a medical setting, waiting in the lobby, sitting in the exam room, worrying about what the doctor will say, activates your nervous system. Your heart rate goes up, your blood vessels tighten, and your pressure climbs. This happens even if you feel calm. Understanding this prevents overtreatment. If your doctor only sees high readings in the office, you might end up on medication you don't need. Home readings give a clearer picture of what your pressure does in daily life. James is 70. Every time he went to his doctor's office, his pressure was high, around 152/90. His doctor suggested starting medication. James asked if he could check at home first. His doctor agreed and told him to bring in a log. James checked twice a day for 2 weeks. At home, his readings were almost always in the low 130s over low 80s. He brought the log back. His doctor reviewed it and said James had white coat hypertension. His pressure was fine at home but elevated in the office due to stress. They decided to hold off on medication. James continued checking at home. 6 months later, his readings were still steady in the 130s. He avoided unnecessary medication because he and his doctor trusted the home data. The white coat effect happens because your brain sees the medical setting as a mild threat. You're not consciously afraid, but your body reacts. Your sympathetic nervous system turns on. This is the same system that kicks in if you're startled or if you have to slam on the brakes while driving. It's temporary. Once you leave the office, your pressure drops back to baseline. This response gets stronger with age because older adults often have stiffer blood vessels, and the same amount of nervous system activation causes a bigger pressure spike. If your office readings are consistently higher than your home readings, tell your doctor. Bring your home log. Most doctors now recognize white coat hypertension and will adjust their treatment decisions based on home data. Some offices use ambulatory monitoring, a device you wear for 24 hours that checks your pressure automatically throughout the day and night. That gives the most complete picture. If your home readings are also high, that's different. That's true hypertension and it needs attention. If you have chest pain, fainting, severe shortness of breath, or one-sided weakness, seek emergency care. Those symptoms require immediate evaluation. This distinction protects you from medication side effects and helps your doctor make better decisions. Now, while we're talking about blood pressure, it's worth mentioning that many older adults manage both blood pressure and blood sugar. The two are connected. High blood sugar over time damages blood vessels, making them stiffer, which raises blood pressure. High blood pressure can also affect how your body handles insulin. If you're tracking both, you'll notice they often move together. A week of poor sleep or high stress can nudge both numbers up. A week of consistent walking and balanced meals can bring both down. You don't need to understand all the science. Just know that habits that help one usually help the other. We'll touch on this more as we go. 5. Lower isn't always better, and pushing blood pressure too low causes falls, confusion, and fatigue in older adults. Many people think the lower the number, the safer they are. That's not true after 60. If your top number drops below 110 consistently, or if your bottom number stays under 60, you might not be getting enough blood flow to your brain when you stand up. This is called orthostatic hypotension, and it's one of the most common reasons older adults fall and end up in the emergency room. This protects your independence and your brain. A fall at 70 is not the same as a fall at 30. Broken hips, head injuries, and loss of confidence all follow from falls. Preventing them starts with keeping your pressure in a safe range, not too high, not too low. Dorothy is 74. She'd been on blood pressure medication for 8 years. Her doctor adjusted the dose a few times over the years, always trying to get her numbers down. 6 months ago, Dorothy started feeling lightheaded when she stood up from her chair. She ignored it at first. Then one morning, she got out of bed, walked toward the bathroom, and felt the room spin. She grabbed the door frame, but her legs gave out. She fell and bruised her hip badly. Her daughter took her to the doctor. They checked her pressure sitting and standing. Sitting, it was 108/62. Standing, it dropped to 88/54. Her doctor reduced her medication dose immediately. Over the next 3 weeks, Dorothy's sitting pressure came up to around 128/78, and her standing pressure stayed above 105. The dizziness stopped. She didn't fall again. Dorothy learned that her old medication dose was too strong for her current needs. When you stand up, gravity pulls blood down toward your legs. Your body normally compensates by tightening blood vessels in your legs and speeding up your heart slightly. This keeps blood flowing to your brain. But if your pressure is already low, or if your blood vessels can't tighten quickly enough, your brain doesn't get enough blood for a few seconds. You feel dizzy, your vision might dim, and you might lose your balance. This happens more often in the morning, after meals, or in hot weather, all times when blood flow is already shifted away from your brain. If you feel lightheaded when you stand, tell your doctor. Don't assume it's just part of getting older. Check your pressure sitting and standing. Sit for 5 minutes, take a reading, then stand up and take another reading immediately. If your top number drops more than 20 points, or if your bottom number drops more than 10 points, that's orthostatic hypotension. Your doctor may need to adjust your medication, change the timing of when you take it, or address other causes like dehydration. Stand up slowly. Sit on the edge of the bed for a few seconds before standing. If you feel dizzy, sit back down. Don't push through it. Drink enough water throughout the day. Dehydration makes this worse. Avoid standing for long periods in hot environments. If you take blood pressure medication, don't take it right before bed if you tend to get up at night to use the bathroom. If you have diabetes, heart failure, or Parkinson's disease, you're at higher risk for this problem. Those conditions affect the nerves and reflexes that control blood pressure when you change position. This awareness keeps you steady on your feet and prevents dangerous falls. Subscribe for more practical guidance on managing blood pressure and blood sugar after 60. 6. Context matters, and sitting readings don't tell the whole story. Your pressure when you're sitting calmly is different from your pressure when you're standing, walking, or lying down. For older adults, the standing reading is often the most important one because that's when dizziness and falls happen. But most people only check sitting. That leaves a gap. Checking both positions helps you and your doctor see the full picture. If your sitting reading looks fine but your standing reading drops sharply, you need to know that. It changes how your medication is managed. Frank is 69. His doctor told him to check his pressure at home. Frank always checked sitting at his kitchen table. His readings were usually around 134/82. He felt fine. Then one afternoon, he stood up quickly to answer the door, and everything went dark for a second. He caught himself on the counter. It scared him. He mentioned it at his next appointment. His doctor asked him to check his pressure sitting and then standing. Frank did. Sitting, it was 136/80. Standing, it dropped to 118/68. That was a drop of 18 points on top and 12 on the bottom. His doctor explained that Frank's sitting pressure was fine, but his standing pressure was borderline low. She didn't change his medication, but she told Frank to stand up slowly, to avoid sudden movements, and to drink more water during the day. Frank followed that advice. He also started checking standing once a week. His standing numbers stayed in a safer range, and he didn't have another dizzy spell. Your body's ability to adjust pressure when you change position depends on your nervous system, your blood volume, and how flexible your blood vessels are. All of those things change with age. Some medications, especially blood pressure medications, diuretics, and certain antidepressants, make it harder for your body to compensate. If you're on any of those, standing pressure checks become even more important. To check standing pressure, first check sitting as usual. Write it down. Then stand up and wait 30 seconds to 1 minute. Take another reading while standing. Write it down. Compare the two. A drop of up to 10 points on the top number is normal. A drop of 20 points or more is significant. If you feel dizzy or lightheaded during the standing check, sit back down immediately and note that. Do this once a week or more often if you've had dizzy spells. Bring both sets of numbers to your doctor. Some doctors will also ask you to check lying down, especially if you spend a lot of time in bed due to illness or injury. If you use a walker or cane, you can still do this. Just make sure you're steady before you check. Safety first. This practice uncovers hidden problems and prevents falls that sitting checks alone would miss. Do you check sitting and standing? Comment yes or no. It helps me see how many people are already doing this. 7. Your doctor considers more than just the number, and your target might be different from your neighbor's target even if you're the same age. Blood pressure goals are personalized based on your other health conditions, your medications, your kidney function, how steady you are on your feet, and whether you've had a stroke or heart attack. A person with diabetes and early kidney disease might need a lower target. A person who's fallen twice in the past year might need a higher target to prevent dizziness. This personalization keeps you safe. Cookie-cutter targets don't work for older adults. Your body, your history, and your risks are unique. Carol is 71. She has type 2 diabetes and her kidney function has declined slightly over the past few years. Her doctor told her to aim for a top number below 130. Carol's friend, also 71, was told to aim for below 140. Carol was confused. She thought they should have the same target. Her doctor explained that Carol's diabetes and kidney issue changed the recommendation. High blood pressure damages kidneys faster when diabetes is present. Keeping Carol's pressure a bit lower protects her kidneys from further decline. Her friend doesn't have diabetes or kidney problems, so a slightly higher target is safe for her. Carol understood. She focused on her own goal and stopped comparing herself to others. Her pressure stayed in the 120s most of the time, and her kidney function stabilized. Diabetes affects blood vessels throughout your body. High blood sugar damages the inner lining of arteries, making them stiff and narrow. This raises blood pressure. At the same time, high blood pressure makes it harder for your kidneys to filter blood properly, and that worsens diabetes control. It's a loop. Breaking that loop requires tighter blood pressure control in people with diabetes. That's why many doctors aim for a top number below 130 in those cases. Kidney disease also changes the target. Your kidneys help regulate blood pressure by controlling how much fluid stays in your body and by releasing hormones that tighten or relax blood vessels. When your kidneys aren't working well, blood pressure becomes harder to control. A lower target protects the remaining kidney function. If you've had a stroke, your doctor might aim lower to prevent another one. If you've had multiple falls, your doctor might accept a higher number to keep you from getting dizzy. If you're frail or over 80, a target in the mid-130s or even low 140s might be appropriate. Frailty means your body is less resilient, and aggressive blood pressure lowering can do more harm than good. Your doctor also considers how many medications you're already taking. Adding more medications increases the risk of side effects and interactions. Sometimes it's better to accept a top number in the mid-130s than to add a fourth blood pressure medication that causes fatigue or frequent urination. Ask your doctor what your specific target is and why. Write it down. Don't assume it's the same as the general guideline you read online. General guidelines are starting points. Your doctor adjusts based on your situation. If your target changes over time, that's normal. As you age, as your kidney function shifts, or as other conditions develop, your target might need to be recalculated. Stay in regular contact with your doctor and update them if anything changes. New symptoms, new medications, or new diagnoses from other specialists. This individualized approach keeps you safer than any one-size-fits-all rule ever could. If you know someone over 50 who's confused about their blood pressure goals, share this video and subscribe for more straightforward advice on blood pressure and blood sugar. 8. Daily consistency beats perfect numbers, and tracking patterns over weeks matters more than worrying about a single high reading. Blood pressure bounces around. One reading of 148 on a stressful Tuesday doesn't mean you're in danger, but if your pressure is 145 or higher every day for 2 weeks, that's a pattern worth addressing. Doctors make decisions based on trends, not isolated readings. This perspective reduces anxiety and helps you focus on what actually matters. Checking once or twice a day and writing it down gives you useful information. Checking 10 times a day and panicking over every fluctuation does not. William is 73. He started checking his pressure at home after his doctor mentioned it was creeping up. William became obsessed. He checked 5 or 6 times a day. If he saw 142, he'd check again 10 minutes later, hoping for 135. If it was still high, he'd feel anxious, which made his pressure go higher. He brought a notebook full of readings to his doctor, pages and pages of numbers. His doctor told him to stop. She said William was creating stress by overchecking, and that stress was raising his pressure. She told him to check once in the morning and once in the evening, no more. William resisted at first, but he tried it. Within a week, he felt calmer. His morning readings were usually in the mid-130s. His evening readings were in the low 130s. He brought that simpler log to his next visit. His doctor said it looked good. William learned that consistency and calm matter more than constant monitoring. Blood pressure variability, how much your pressure jumps around from reading to reading, is actually a risk factor on its own. People whose pressure swings wildly from 120 to 160 throughout the day have a higher risk of stroke and heart problems than people whose pressure stays steadily around 140. Stability matters. Overchecking, overworrying, and overreacting all increase variability. Check at the same times each day. Write down the readings. Don't check more than twice a day unless your doctor specifically asks you to. Don't check after arguments, after exercise, or after anything upsetting. Those readings aren't helpful. They just reflect temporary spikes. Look at your log once a week. Calculate the average for the week. Is your average top number in your target range? If yes, you're doing well. If no, note it and continue tracking. After 2 or 3 weeks, if your average is consistently above target, call your doctor. Don't wait for your next scheduled appointment if the pattern is clear. If you see one high reading, don't panic. Sit quietly for 10 minutes and check again. If the second reading is normal, the first one was probably a fluke. Move on. If the second reading is also high, note it, but don't check again for several hours. One day of high readings can happen. A week of high readings is meaningful. Bring your log to every doctor visit. Your doctor will look at the overall pattern, not individual readings. That pattern guides decisions about medication, lifestyle changes, or further testing. If you know someone over 50 who could benefit from this, share this video and subscribe for more simple blood pressure and blood sugar tips.